So let us begin with Alan Skinner's study streak, and we are discussing a few remedies for the female reproductive system. And what is interesting is that it's not only female reproductive system which those remedies work on, but also the rheumatic complaints. Like for example, Thalaspi bursa pastoris, Ustilago, Sabina, all these remedies can be given in cases where rheumatic complaints are also predominantly present with a trace of female reproductive system changes or diseases. So a remedy which is in connection with all the remedies that we have discussion which we have discussed in the last few days. Today's remedy will be Millefolium. The first line that for Millefolium in Allen's keynotes is mentioned as ailments from overlifting, overexertion, or a fall. So, you know, many times you will get cases who will report that there is, you know, intermittent episodes of bleeding in a case of female, or there are hemoptysis or a kind of a hemorrhagic diathesis after certain episode of injury, and it's not a recurring process, it's just one or once in a while. That should be your grounds for prescribing Millefolium. So we are live on Instagram and YouTube simultaneously, and there are many audience on Instagram and also on YouTube. And if you are watching this video, if you are studying along Alan's keynotes, there are a lot of remedies that we have discussed in the last 2 to 3 months. Like we started from June, and this is the almost third or fourth month going on, and we'll finish all the remedies. What is their clinical relevance? How will you see the patients in clinic? What will be the symptoms that will be of importance in your clinic from Alan that you are reading? Because there are some symptoms that are important from the academic point of view, but if you see the same symptoms clinically, they will be not present. That is what you need to learn, which symptoms will be present very strongly in your practice, which symptoms will be relegated to the background. Those differences once established, your ability to understand Allen's keynotes and use it as a very strong parameter for prescribing remedies in your clinic becomes very easier. So Millefolium, next we have is hemorrhage, which is painless, without fever, bright red. So all those cases where there is hemorrhage from the nose, from the other parts of the body, but there is no fever, the hemorrhage goes on for a long time, bright red in color, should be your recipe for prescribing uh, Millefolium. The fluid is blood, or it's not lot of clots or lot of mixture of anything. It can be from lungs, bronchi, larynx, mouth, nose, stomach, bladder, rectum, uterus, or of mechanical origin. Now it's interesting. So not only the cases where the blood is coming out from needs to be given Millefolium, but all the other conditions, you can see that there are instrumentation surgicals done where after the surgery the bleeding persists for a long time. That should be Millefolium for you. If there are people who strain while passing urine, while doing hemorrhoids, while passing stool, and if they have also complaint of hemorrhoids, and since that straining episode they have developed hemorrhage, that should be Millefolium for you. So in this way, there are people who have strained a lot to bring out the sputum, and since that time the bleeding is persisting, that should be Millefolium. So there can be many different origins of the blood, but wherever in the body the blood is originating bright red and fluid in nature, any part of the body, think of Millefolium in that case. Similar remedies arnica and also hemamelis. Hemamelis is especially for the wounds, but arnica would mostly be mechanical injuries where it will be indicated. Fluid, which is bloody in nature, also has grounds for prescribing aconite, ipecac, and sabina. We read sabina yesterday. All those who wish to read it again can go back and see the lecture on sabina. Next, you have is wounds which profusely bleed, especially after a fall. Arnica and hemamelis and millefolium are the top three contenders for such cases. Vertigo in millefolium when moving slowly, but not when taking violent exercise. So they feel good when they are doing loose exercises, very slowly, slow activities. But as soon as they are doing some strenuous activities, they surprisingly don't have vertigo. At times, you will get this presentation in your clinics. Next, you have is hemoptysis from the chest, respiratory organs, which happens after injury, chest injuries, or someone who is hit in the chest, someone who had a fight, or someone who has any chronic ailment like phthisis, tuberculosis, or since the time phthisis was there was this hemorrhage that kept on happening. That should be your indication for millefolium. And also they will concomitantly 110% present also with complaints of hemorrhoids. So those are the grounds for prescribing this remedy. And the cough, which is bright red, and also it is there in suppressed menses or hemorrhoids. Patients will have this type of cough, which also brings out lot of sputum, which is bloody in nature. Operation and palpitation are accompaniments of such complaints. And after a fall from a height or after violent exertion with blood, they have these complaints which develop over a period of time. Millefolium should be indicated. It also is one of the interesting things, cough which happens mostly in the evening at 4 p.m. Similar presentation we see also in lycopodium. Next, you have for female reproductive system painless drainage. So all those cases who have bleeding going on since many days, but there are no other complaints. Surprisingly, in trillium pendulum we saw similar presentation. Thalaspi bursa pastoris we saw similar presentation, but they will have some associated complaints. Over here, the complaints are completely absent. There is just this bleeding going on since many days, and it will not only be from the uterus but also from other part of the body. It can be some one or second part like nose, it can be from the lungs, etc. And after the pregnancy, after the labor, after the delivery, when the bleeding has not stopped, that should be indicating millefolium for once to differentiate with the other remedies. There is also great exertion during the delivery time, which results in such a state. It should give you a thought for millefolium. And if it is given as a preventive remedy before the delivery happens, if you get a chance, like we have already discussed in few of the lectures, getting homeopath in the delivery room is very difficult, but if you get a chance to use those drugs, it's you know jackpot for every one of you. Next, you have is menses early, protracted, suppressed with colic or pain in the abdomen. Leukorrhea of children with atony. Calcarea carb, one of the top remedies for leukorrhea in children. Copaiva is another. Millefolium is another. There can be sapien sulfur, which also can run neck and neck with these remedies. Comparing millefolium with other remedies, there is erysipelas, which is also useful in epistaxis and hemoptysis, and the blood is bright red. Millefolium can often follow well the remedies like aconite and arnica when they have been given, but there is not much result seen clinically. The bleeding is there, still of a lesser nature, but it's still not gone. So those should be your indications for prescribing millefolium. That's all from today's short session from Alan's keynotes, and we'll see again tomorrow with another remedy from Alan's keynotes, which is still not done. And if you are reading along this Alan's keynotes in this session, it is definitely going to help you to become a master prescriber over a period of 3 to 4 months after you go through all the sessions of Valence keynotes. So do let me know in the comments below how do you like this lecture and short session actually, and let me know if you have used Millefolium in any of your cases. I had used it once in a case of chest trouble where the patient had coughed very strenuously, and since that time he used to have this speck of blood coming. It used to be, very thin, like a water, and that patient received Millefolium 200 twice a day, just 2 or 4 doses, and he was set all right. So you can make your own landmarks for prescribing this remedy, and where you have prescribed, how you have prescribed. Do let me know.